Hi, good afternoon. I'm Brittni Dash, and I'm the Director of Clinical Services at Smile. I have about 14 years of experience in the therapy field, and so being able to work with the LGBTQ community as far as giving affirming therapy has been something that's very important to me. And so just knowing how to appropriately provide those services is just something that is important because not a lot of safe spaces are created for this population. I currently work at Smile, which is an LGBTQ organization that provides multiple different levels of services to the youth in our community. And so later on, I'll go into a little bit more of what kind of services we provide. So why is affirming mental health support important for the LGBTQ community? Well, first, LGBTQ individuals who struggle with their identity, they also have higher rates of anxiety, affective disorder related conditions, substance abuse disorders, and they most likely struggle with the stigma of coming out and just being accepted. They also have a higher suicidal rate, as well as they also face disparities such as medical, physical, increased tobacco use, HIV and AIDS, and sometimes weight-related problems. And they're also at a greater risk for discrimination for verbal abuse, physical abuse, assaults, violence, and increasing like workplace environments that are not really protective, as well as less access to housing and healthcare. So there's also a big fear of potential discrimination that's contributed to the LGBTQ people not seeking help that they need medically or physically in a timely manner at all. So if I go to the doctor, and somebody can't identify me correctly, or they provide me with less services, or they treat me differently, I'm less likely going to want to reach out to somebody for help, because every time I go to those type of environments, you make me feel like I'm less important than the other. So a lot of people are more likely to wait to, they don't have any choice but to reach out for that services. And by that time, it may be too late. It may be in this place where they could have gotten help earlier, but something now bad is happening. Now they have to kind of face the consequences behind that. Studies also have shown that many people are afraid to be open about their sexual orientation or feelings with their mental health providers. A lot of times being able to feel comfortable with the people that are providing therapy for you is very important. Sometimes there are not spaces that are created very safe, where the environment says, hey, here's an open environment. Hey, you can come in here and you can talk about anything. And if you don't have that environment that's set up for the people that you're providing that service for, they're not going to talk. They're not going to open up. They're not going to express themselves. So then they just figure out that they'll just give the basis of certain information without really going in depth of what their true issues are. You go back. Additionally, most LGBTQ individuals are not raised by parents or people who actually identify as LGBTQ. So they might not have the ability to have that support in their household. And so they don't have the necessary people around them to really understand what the struggle is that they're going through. And then you also have the internalized homophobia. And that's when you're really struggling with the self-acceptance. And so because you don't want to accept that maybe you're gay or that you're a lesbian or that you're bi, you kind of internalize all those feelings and then spew more hate about the LGBTQ community just to avoid accepting that, because you're struggling with what that might look like for other things. There you go. And so when we look at the best practices to clinically supporting the mental health of the LGBTQ youth for parents, one of the things that you want to teach the parents about, or for parents to actually know, is that it's very important to let them know that they're loved. When you feel like you're already different, or that nobody understands how you're feeling, or that if you tell somebody that you have these feelings, or that you identify a certain way, that nobody's going to love you or care about you, this is one of the first steps that means a lot to individuals in this population, because the biggest thing that you want to know is, maybe I don't understand it, or maybe I don't fully know how to accept it, but at the end of the day, I still love you. And so knowing that somebody still loves you and cares for you, that means a lot, and it goes a long way. Then you want to encourage dialogue. If I don't understand what you're going through, if I don't understand how you're feeling, and I just pretend or ignore the situation because it's not something that's comfortable for me, then I'm putting my child in a box to be alone, versus encouraging dialogue to kind of say, well, tell me what you're feeling. Tell me how you felt about this, or how's this going? Even if it's just random conversations for questions that helps you understand your child better, it's still encouraging that dialogue. Then you want to learn about facts. You know, a lot of people have myths about, oh, this is just a phase, and all these different kind of things that are not factual information, or something had to happen to you in order for you to be this way. Learn your facts about certain things, so that when your child is expressing what they're going through, you're not coming to them with information that's not factual, or information that's based off of some random myth that was read, and then that will make them feel like they're make them feel that they're not unable to actually express themselves because you don't understand them. Then you want to look out for signs of bullying. We all know that we're in an environment where there's not a lot of people who actually understands or accept individuals in the LGBTQ community. And so being able just to let your child know you support them and you're monitoring that goes a long way when you're talking about suicidal ideations from not feeling accepted. Then you want to take a team approach. If I don't understand what you're doing, or what you have going on, or how you're feeling, then I'm going to find people who can help you. If I don't know the best way to possibly help you or support you, then I want to find a support system that's best for you. That's what a team approach looks like. And then ensuring that they form healthy relationships. In natural heterosexual relationships, we tend to teach girls how to accept treatment from boys, or teach boys how they're supposed to treat girls. But a lot of times that's not taught in relationships of the same sex. So being able to teach them what they should do or how they should act in the same-sex relationship is just as important, or relationships within the LGBTQ community, because sometimes those lines could get blurred, and being able to show them what that looks like. When you feel like nobody understands you except for the person you with, it's harder to let go of toxic relationships. And so they tend to merge together, because if I let that person go, who else do I have? And then you also want to ask them, how do you best support them? And to understand that this is a journey. You know, we're going through different stages and we're going through different steps. So maybe they say they're bisexual this year. Next year, they may be a lesbian. People are going through a constant version of change to figure out who they really are. So maybe at one moment they were bisexual. Maybe in the next moment they were gay. It just depends on how they're working through their own identity. And it's okay, because it's their journey. So now we move to best practices to clinically support in the mental health of the LGBTQ youth for providers. So when it comes to providers, one of the things that you want to first do is, with new patients, you want to create an accepting and affirming environment that's not assuming sexual orientation or gender identity. You know, so don't assume somebody is a man or a woman, or where their pronouns are based off of how they look. You also want to be able to create an environment in your workplace that allows people to kind of flow as they should, gender neutral bathrooms, you know, just things of that nature that just makes a more safe space. You also want to assess the level of openness and self-acceptance. Just because I identify as maybe a lesbian doesn't mean I'm open and willing to talk about it. So being able to figure out what they want to share, where they are with sharing, what level they are on with being out, means a lot, because you want to help them get to the place that they want to be in comfortability. You don't want to say, well, you said that you're this, so this is how you should act. You want to make sure you're assessing where they are. And then you want to be aware that, you know, there's no such thing as conversion or reparative therapy. You know, it's very important that that individuals understand that conversion therapy is not an appropriate reaction to their child, to a youth or a child being that's identifying as LGBTQ. that is very damaging and is harmful to anybody else, to anybody who's trying to put their child in that, and it leads to higher suicidal rates, depression, and anxiety. And then you want to also be aware, that families can be helped to accept their gay or lesbian or transgender children. Understanding that when they learn how to accept them, it just decreases their depression rates, their suicide rates, and their anxiety. At some point, when somebody brings something new to you and they're saying, this is who I am, individuals have to go through a sense of loss. Sometimes it's a sense of loss of what I imagine my family to be like. I imagine my daughter is going to marry this man and she's going to have kids and that's what it's going to look like. And then it doesn't happen. I have to go through that process. I have to understand what that's going to be like. And so initially I may be a little upset. I may be a little bit frustrated, but it's okay because they can be taught how to move past that. You also want to look more into providing trauma-informed care. Because the LGBT community are highly targeted. So sometimes they experience a lot of trauma in addition to just their identity as a whole. So being able to provide that trauma-informed care to address the trauma underneath and not it being just their sexual orientation or their identity that is the main focus, but addressing that trauma underneath so that they can function in addition to them dealing with their actual sexual orientation. Then you want to provide physical and emotional safety by meeting the patient's needs, clearly establishing and communicating safety procedures, and fostering respectful relationships. So meeting your client where they are and making sure that you're providing them with an emotional safe space to share the information that they're given. You also want to create an inclusive environment. There was a client who came into an office at one point and they were prepared to kind of talk about their coming out process and all of the above. And when they walked in, everything in the office had Bibles and crosses and a lot of things that just depicted just a real religious background, which nothing is wrong with that. But there was nothing else in the office that depicted gay or lesbian or transgender relationships or anything about the LGBTQ community. So immediately that client shut down and clammed up because they didn't want to feel like they were going to be judged for sharing that information. So how you create an inclusive environment may mean I might have a Bible over here, but I might have a picture over here that says all is welcome. Anything that says inclusive is important because you want to make sure that I'm saying I may have this belief, but I also can support you in that belief. And then you want to screen for trauma, making sure that certain behaviors that a person is displaying is not a result of their trauma that they've experienced. And then plan for continuity of care. If I'm providing therapy for a person, then I'm also looking at how to best successfully serve this person. Do they need group therapy? Do they need to be a part of a mentoring organization? What else do they need as a whole to make sure that they're fully supported? That's what planning for continuity of care looks like as the provider. I might have got the initial referral, but in working with them, now I need to figure out what else do they need. And then you want to educate the public with culturally relevant materials and from your organization, making sure that the people that you're also working with are supporting your clients the same way, that they're providing with the same level of respect, the same level of support that they should be providing with them so that they're comfortable when they step out to these other agencies that you're referring them to. Then you want to make sure that you're educating your staff to foster inclusive behaviors. And that may look like what it looks like as your staff as a whole. A lot of times in the workplace, we don't recognize how much we isolate people who might be of the LGBTQ community by saying things like, oh, do you have a boyfriend? Oh, do you have a girlfriend? Just like automatically making automatic assumptions versus saying, oh, do you have a partner? Oh, not making automatic assumptions where somebody feels like if you found out that they would be judged, they wouldn't be accepted the same way. So in your staff environment, you should be fostering those same behaviors so that you understand how to treat individuals in the LGBTQ community as a whole. Then you want to address harassment and tolerance of peers who are also in the treatment program. You know, everybody's in different stages sometimes in their LGBTQ kind of journey. And so making sure that the people around them are supporting each other and making sure that they are saying the right things to each other and they're being respectful to each other is also a role in the provider's kind of atmosphere. And then you want to make sure that you're implementing the right trainings for the people that are working for you. You know, are we not just the average LGBTQ trainings that says the labels and things of that nature, but going in depth into trainings and figuring out what it's like to work with a trans client. What is it like to work with a client who maybe identifies as LGBTQ youth, but does risky behaviors? Understanding all those things is fostering trainings to work with all the different issues that come within this population. And then you want to be able to acknowledge the emotional and sexual lives of the LGBTQ clients. You know, we talk to heterosexual clients about safe sex and love and all the above, but then there becomes this uncomfortable bubble behind the LGBTQ clients. So then there's nobody giving them advice. There's nobody giving them the right type of guidance. So then they go out and they make a bunch of poor decisions, but it's because there's nobody there to support them in the way that you would normally support an individual at an age-appropriate age for certain things. And so that same level of support that you provide a heterosexual client regarding love and dating and things of that nature, the same thing should be given to a homosexual client. And so that brings me to my agency, which is SMILE. And SMILE is basically a way to kind of provide a wraparound service for the LGBTQ youth in the DMV area. So we first have our youth development and community engagement. And that program is based around drop-in programs for the kids to have basic social interactions with other individuals in the LGBTQ population. So whether it's going on an outing together, whether it's a paint night, whether it's spoken word, all these things that are events that they kind of host under that youth development. They also do pride events, parades, and all these different kind of things to kind of add into that. Then we have our Little Smiles program, which is something big because we don't necessarily identify, we don't usually, a lot of agencies don't serve the population as young as 6. So Little Smiles give them like a social atmosphere to kind of, for parents and youth, to find other kids who are going through the same thing that they're going through, and other parents to kind of provide that level of support. And they do groups with Little Smiles, and they do activities, and they take them on little outings just so they can have that level of inclusiveness. And we also have our youth housing program, and that's for our homeless youth that are 18 to 24 years old, who are struggling with finding housing, but also safe housing. If I'm a transgender client and you put me in this random homeless shelter where I don't feel safe, or I can't be myself, then it's hard for me to find support that I need or to successfully integrate back into society when I feel scared most of the time with where I'm going to live or what I'm going to do next. And then you have the clinical service program, which is my program. And our clinical services program provides individual, group, and family therapy for free for up to 6 months. And so this is a way that you can allow your clientele to get affirming therapy with therapists who understand how to provide services to the LGBTQ youth with the support that they need to kind of get them to their next level. And we have 2 groups coming up. We have a middle school group and a high school group coming up on starting May the 5th through, I think, the end of June the 30th. And those 2 groups are going to be separated groups, and they'll go for 9 weeks. And that just provides some more youth individuals just the opportunity to kind of have that safe space to learn and understand themselves in just a much better dynamics. So if anybody knows youth, or you know individuals of the LGBTQ community who will benefit from these services, then please make your referrals to SMILE, and definitely make the referrals to send them to those groups. And just kind of like the parents said, I think there's going to be a time where we come back and answer more questions. But if you have any questions, feel free to put them in the chat, and I'll do my best to answer them. Thank you for your time.